So surface anatomy is a study of the anatomical landmarks on the external surface of the body. Okay? So knowledge is practical applications. Understanding critical during medical examinations. That's one of the things you need surface anatomy. They point to something and say, what is this? Understanding this both for invasive and non-invasive laboratory procedures. Everything from giving an injection in the gluteus maximus, okay? You don't want to hit the sciatic nerve. You got to know where the sciatic nerve runs. If you hit that, your patient's going to go down and be paralyzed for a while. Okay? So you have to know your anatomy, know your landmarks. You have to know where to take a pulse, where to find swollen lymph nodes. You have to know where these things are. Okay? You estimate location of body parts. And if there's trauma, you got to know what's underneath it. You got to know what you're getting into. Okay? And know the palpation points, what you can touch, what you can touch and feel. So it's best studied using a regional approach. We break this into different regions. Okay, the regions are the head and the neck, the thorax, the abdomen, upper limbs, lower limbs. The head region, the bony areas of the head region, the supraorbital margin, the mental protuberance, the body of the mandible, zygomatic bone, angle of the mandible, and the mastoid process. We've covered all those. So now you just got to think and picture the skull and then picture the outside and be able to identify where those landmarks are by assigning that to the position that you know are on the skull. You look at the surface, and here's your supraorbital margin. Okay, you can see where it comes up, and it's just above the eye socket. That's your supraorbital margin. The mental protuberance is the tip of your chin. Your glenoid tubercle, where it comes out of the skull right there. That's your mental protuberance. The zygomatic bone we talked about a lot. This is the lower arch. This is your cheekbone. Okay. If this eye droops, coming in the emergency when that eye's drooping down, this bone is broken. That's the most common bone to break in a lateral impact to the head, because that's when it sticks out the farthest. This one's going to hit first. And then the body of the mandible. Your body of your mandible comes here, then your angle, then your ramus as it extends down. So you should be able to identify all those parts on the external side of the body. It'll get a lot tougher than this. These are the easy ones. So far, so good. Okay, yeah. Advanced too far? Where are we at? Okay. Okay, you also have the temporal region. Remember the temporal bone lies right here. So this is your temporal region. This is your zygomatic arch that we have. The angle of the mandible. This is the body. This is the angle. That's the ramus. Okay, and your mastoid process. The mastoid process is just below this, just inferior to the opening of the ear, which is your inferior, your auditory acoustic meatus. Okay. In the neck region, you have the clavicle, which you can palpate. You have the suprasternal knot, which is a knot above the sternum, and you have the manubrium of the sternum. So here's your clavicle. See the clavicle here and the clavicle there. Okay, that's your collarbone. What two bones does a clavicle connect to? Articulates with what over here?
The sternum and the sternum.
The sternum and the
acromion, the scapula.
Scapula, acromion of the scapula. Perfect. Okay, so this is your clavicle. Okay, this is a suprasternal notch, which you remember the manubrium sits up here, and then the body of the sternum as it comes down. Almost looks like a tooth, huh? Okay. And the sternum manubrium is right here. This is your manubrium. I'm not a great artist. Neck muscles, the trapezius and the sternocleidomastoid. Trapezius comes from the back and wraps around over the top of the shoulder. The sternocleidomastoid, remember we talked about this, sternocleidomastoid. It originates on the mastoid process of the skull, okay? And has two connection points. Connects to the sternum and it connects to the clavicle. Okay? So here's the trapezius muscle. Again, it wraps around from behind, it goes over the neck. That's the attachment of the trapezius muscle. And the sternocleidomastoid comes from the mastoid process here and has one connection. The head, the sternocleidomastoid head is the clavicular head, connects to the clavicle, and the sternocleidomastoid muscle, the sternal head, connects to the sternum. This whole muscle has two connection points here. Okay, so it's called the sternocleidomastoid. And you can see that on the patient. Okay. Again, here's your sternocleidomastoid. You can see the muscle lash. Here's what it attaches. Here's a mastoid process. So this is what this muscle extends to with two attachments. Okay, the neck has the thyroid cartilage and the cricoid cartilage. We talked about that before too. This is the thyroid cartilage. Remember, the thyroid cartilage are C-shaped rings that hold the trachea open. And this is the cricoid cartilage. This is where you do emergency procedure. And the cricoid thyroid, it's called the cricoid thyroid membrane puncture. You lift your neck up, you run your hand under your Adam's apple, there's a space right there. That's just between the Adam's apple and the cricoid cartilage. That's what you puncture. You take a knife, you take anything you want, and that's what you puncture there to get it. And that's going away. Okay, like I said, it's avascular. You get very little bleeding just from the skin, and you get a big whoosh of air if that airway is constricted. Ludwig's angina, like the aspirin allergy can produce Ludwig's angina, which is a swollen tongue, and you do a cricoid thyroid membrane puncture. And we talked about the number one thing for blocking a child's airway, right? What's the number one food that blocks a child's airway?
Hot dog.
What was it?
Hot dogs.
Hot dog. Perfect. Because a hot dog is the exact same diameter as a child's airway. That's why I always cut hot dogs longitude on the long lengthwise before I get to my grandkids. Everybody thinks I'm crazy, but that's what I do. They won't get stuck in their airway. Neck triangles. You have the anterior cervical triangle and the posterior cervical triangle. And the difference between those is one's in the anterior, one's in the posterior. What separates them is the sternocleidomastoid muscle. So if you ever see the question, what separates the anterior cervical triangle from the posterior cervical triangle, the answer is going to be the sternocleidomastoid muscle. Okay, so here's your anterior cervical triangle and your posterior cervical triangle. And what runs right between them, okay, is the sternocleidomastoid muscle. Okay, your anterior cervical triangle is divided into four other triangles: the suprahyoid, the submandibular, the superior carotid, and the inferior carotid. Okay. So here's your superior hyoid triangle. Okay. Your submandibular triangle, just below the mandible. Okay, your superior carotid triangle. And your inferior carotid triangle. So the different divisions of the anterior cervical triangle. Okay, there's sites you palpate, that you feel for things in the anterior cervical triangle as a nurse. Okay, you have the submandibular glands there. You got the submandibular lymph nodes. You got your thyroid cartilage, your jugular notch, and your carotid pulse. All those things are palpated in the anterior cervical triangle. So everything's in front of or anterior to the sternocleidomastoid muscle. Okay, and this is a site for palpitation of your submandibular gland and submandibular lymph nodes. If you feel under your chin when you get sick, you open your jaw right at the angle of the mandible. You feel it in the cervical area here. Those are your cervical nodes. Those swell up when you get sick. Okay, those are your lymph nodes. They attract bacteria and pathogens and are signs of an infection when they get swollen. The carotid pulse is placed to the side of the trachea. and you feel for the pulse with your fingers. Why do you not feel for the carotid pulse with your thumb?
Your thumb has a pulse?
Your thumb has a pulse. You'll get a false pulse. A lot of people, when they used to teach CPR, they'll take their thumb and their finger, they'll go like this and surround the trachea like that and feel both sides. That'll give false indication. You always move your thumb and you feel one side or the other, usually with the first two fingers. Okay? Because the thumb has a pulse of its own. That's what you always feel with one of your digits beside the phalanx. Okay? You have the thyroid cartilage, which you can palpate. That's your Adam's apple. And you have the jugular notch, which is just above the manubrium of your sternum. Okay? Those are all palpable points in the anterior cervical triangle. Okay? The posterior cervical triangle has three areas also. You have the brachial plexus, you have your acromion of the scapula, and you have your external jugular vein. Okay? So here's your external jugular vein, leads to the petit muscle, which is your in your posterior triangle. Okay? The brachial plexus, which is right across here, and the acromion is that point on your scapula that you can feel in the back there where your joint hinges. That's the high point. Thoracic region. Okay, if you look at the front of the thoracic region, you have your clavicle. Again, we've gone over all these, so you know where they are, but you have to picture the skeleton underneath the skin now, so you know where these points are on the surfaces. So you have the clavicle, the jugular notch, acromion, the manubrium, body of the sternum, the xiphoid process, and the costal margin of the ribs. Now, we talked about the xiphoid process in doing CPR on infants. Okay, what's the significance of the xiphoid process when you have to do CPR on an infant? Okay, that's the reason infants have different rules or different positions of your hands. An infant is always mid-nipple line. An adult is below the nipples. Okay, in the infant, the liver is disproportionately larger than the rest of than the baby. So if you press lower like you do on an adult, you'll take the xiphoid process of the sternum and push it through the liver and lacerate the liver, and the infant will die. Okay, so when you do CPR on an infant, it is always mid-nipple line with two fingers, and that's where you do your pressing. Because you don't want to press that xiphoid process, which is a tip, okay, right through the liver. Okay, that's the xiphoid process for infants. Okay, but you have your jugular notch, which is the manubrium, which is the groove on top of the manubrium right here. You have the clavicle that runs across. You have your acromion, which is the tip of the scapula, where the pectoral girdle is. Okay, you have the body of the sternum, which is below the manubrium. Okay, you have your xiphoid process, which is right there, okay, just below the body of the sternum. Xiphoid process. You have the costal margin of the ribs, where the ribs attach to your sternum. Okay. And you have the manubrium of the sternum. Okay. Muscles in that area. You have the pectoralis major. Okay. There's two main muscles involved in abducting and adducting the arm. Okay. When you abduct the arm, you're taking it and you're pulling it away from the midline of your body. That muscle is a deltoid. You can feel it. You can feel that deltoid on your shoulder pulling. When you take that arm now and pull it back into the muscle, into the body, that's adduction. And this is your pectoralis major. Your pectoralis major is the main force pulling that arm back into the body. So the deltoid muscle is abduction of the arm. The pectoralis major muscle is adduction of the arm. You'll see that a lot in your nursing exams between abduction and adduction. And those are two major muscles that do it. There's other accessory muscles, but those are the major ones. And other areas are the areola and the nipple, and then the axilla or your armpit. Okay, so this is the axilla. This is your armpit right here. That's the axilla. And then the pectoralis major is a muscle right here. And this muscle slings up into here. Whoops, I hit the wrong button. Okay, and it allows his arm to pull back in this direction for adduction. And then you have the areola and the nipple. Oops, what did I do? There we go. Thoracic region. Okay. The bones of the thoracic region are vertebrae C7. And that's the end of the cervical vertebrae. That's where the thoracic, the T1 starts right after C7. You have the spine of the scapula that you can feel, the vertebral border of the scapula, and the inferior angle of the scapula are all palpation points. Okay. So here's the spine of the scapula. Okay. Vertebral border of the scapula and the inferior angle of the scapula. Okay. And this is vertebral prominence of C7 right here. That's this point that sticks up in the back of your neck. And then just below that, we start the thoracic vertebrae, T1 through T12. Okay. You have muscles in that area, the infraspinatus, the trapezius, the dorsi, and the teres major. And you also have a furrow over the spinous process of the thoracic vertebrae. That's a groove that runs down the center of the spinal cord, not a furrow or groove. So here's your trapezius muscle. Again, this muscle comes up here, extends, that's the trapeze, extends over the shoulder. That's your trapezius. The teres major muscle and the teres minor is just above it. Latissimus dorsi, the muscles along the side here. Okay, we haven't gotten into all those muscles yet, but we will. This is the furrow, which is your groove that runs on your spinal cord, and the infraspinatus muscle. Muscle areas in the abdomen, we talked about a little before this with the movie 300. The rectus abdominis, serratus anterior, and the external obliques. Other areas in that area are the umbilicus and the tendinous inscriptions. Remember, the rectus abdominis are the muscles that give you your six-pack, and the tendinous inscriptions are the areas where those muscles are defined, where each one of those is separated. Okay, so here's your rectus abdominis muscle. That's your muscle. That's the muscle. That's the muscle. And between these lines, okay, that's your tendinous inscriptions. You can see these lines right here. Okay. Your serratus anterior muscles along the edge, and your external obliques run inferior to that. And then you have the umbilicus. Abdominal region. Posterior view of the abdominal region, the muscles in the back are the latissimus dorsi and the erector spinae. Okay. There's the latissimus dorsi muscles on the side, and then the erector spinae goes on both sides of the spinal column. Okay, the arms. We talked about the lateral epicondyle and the medial epicondyle. Okay, that's on the humerus. Muscles that are talking about the deltoid, which is your abductor muscle. Talk about the triceps brachii and the biceps brachii. So the deltoid muscle, we said was an abductor muscle. Triceps brachii is an extensor muscle. The biceps brachii is a flexor. I can't write very well. Flex. Flexor muscle. You have the brachialis and the coracobrachialis, also both flexor muscles. Okay, so muscles in the anterior compartment of the arm are flexors. Posterior part of the arm are extensors. Okay, so here's your deltoid. Okay, and that's an abductor muscle. When that flexes, the arm moves away from the midline. This is your bicep brachii and brachialis, your biceps brachii. These are your flexing muscles here. This is your tricep brachii. You have the lateral head and the long head. Okay? And these are your extension muscles. And this is the lateral epicondyle of the humerus, the one that sticks out there. Then again, the tricep brachii lateral head. Okay? It's an extension muscle. The triceps brachial long head, triceps brachial medial head. There's three heads. That's what's called triceps. There's three heads to it. Okay, there's a lateral head, a long head, and a medial head. And those are extension muscles of the arm. And you have the tendon insertion of the triceps brachial muscle just below here, where your tendon inserts into the elbow. And then the medial epicondyle of the humerus, on the medial part of the arm. You have your lateral epicondyle of the humerus and your medial epicondyle of the humerus that you can feel. And looking at the front view, you can see the deltoid muscles, the coracobrachialis, biceps brachii muscle, triceps brachii, long head in the back, and the medial epicondyle. Okay. All points you can identify on the external surface. Okay, and the upper limb, the forearm, you have the olecranon, you have the styloid process of the radius, and the head of the ulna. In the anterior view of the forearm, you have the brachioradialis, the flexor carpi radialis muscle, the pronator teres muscle, the tendon of the flexor carpi radialis muscle, tendon of the palmaris longus muscle, tendon of the flexor carpi ulnaris muscle, and the tendon of the flexor digitorum superficialis muscle. Okay, and we're going to see all those just a second here. We also have from the back, you have the brachioradialis, the extensor carpi radialis, the longest and the grievous, the long one, the short one, Aconius, and the extensor digitorum. Okay. So this is an olecranian, elbow joint right here. The Aconius muscle, the extensor digitorum muscle, extends the digits, runs down into the hand. Brachioradialis, the extensor carpi radialis longus, the extensor carpi radialis brevis muscle. The styloid process of the radius you can feel just above the thumb there. And that's the head of the ulna. It's that bone that sticks out, okay, on the medial surface. Okay. Again, the brachioradialis muscle, the pronator teres muscle, and the flexor carpi radialis muscle, or in the lower part of the arm. And the tendon of flexor carpi radialis, you can see when you flex your wrist, and you see that tendon that sticks out. Brother? Okay, that's the tendon of the flexor carpi radialis muscle. Remember, that connects the muscle to the bone. Tendons connect muscles to bone. Ligaments connect muscle to bone to bone. Okay, so tendons connect muscle to bone. So that connects the flexor carpi radialis muscle to the bone. That's your tendon right there that pops out. The other tendon you can see on the side of it also are the tendon of the flexor digitorum superficialis muscle, the tendon of the palmaris longus muscle, and the tendon of the flexor carpi ulnaris muscle. But the big one that you see every time that you flex your muscle, it pops out, is your flexor carpi radialis, tendon of that muscle. Okay, other areas in the arm and forearm, the cephalic vein, the celiac vein, the median cubital vein, that's what you go after you're giving an IV, site for the radial pulse, and site for the palpation of the ulnar nerve. Okay, so here's the cephalic vein, runs on the side here. This is the basilar vein. Okay, this is the cubital fossa. And the median cubital vein is what runs here, and that's the one you do with your IV. The median cubital vein, is that the big one that bulges out that you go after with your IV? And your palpation for your radial pulse is right on the thumb side of the wrist. Okay. And this is palpation for the ulnar nerve. And you know when you hit it because you hit the funny bones. You know when you hit that nerve. That's when you can feel it. Okay. In the wrist area, you have the pisiform bone and the head of the ulna that you can see, and the site for the radial pulse palpitation. Okay. You see the head of the ulnus popping out on the inside by the little, on the wrist by the on the side of the little finger. This is the head of the ulna. Okay. And this is the pisiform bone with the palmus brevis muscle that attaches to the wrist right there. And again, just remember the bones and look at this, looking underneath it for the external markings. Pelvis region, gluteal region, gluteus maximus and gluteus medius. Okay. Location of sciatic nerve, gluteal fold, which is the fold of your buttocks, and the gluteal injection site. It's important to know the gluteal injection site and where the sciatic nerve runs. You want to go in the gluteus maximus muscle. You do not want to hit the sciatic nerve. You hit the sciatic nerve with your injection, that patient's going to go down instantly. You don't want to hit that nerve. It's extremely painful to a patient. And what you do with your injection site, your gluteal injection site is up high and lateral. Okay. The sciatic nerve runs more medial. So you always go high and lateral when you do your gluteal injection site. So you avoid the sciatic nerve. You have your gluteus medius muscle and the gluteus maximus muscle. And you get the fold of the buttocks. Okay. Remember the greater trochanter of the femur and the patella bone. Okay. Here's the patella bone. Use your kneecap. Easy, fine. And then the greater trochanter of the femur, you can feel the bone up the lateral side of your femur bone. Different muscles of the area in the anterior thigh. You have the tensor fasciae latae, sartorius, the rectus femoris, the vastus lateralis, vastus medialis, gracilis, and the adductor longus. Okay, you can see where those are located. Okay, your sartorius muscle. Okay, your tensor fasciae latae muscle on the side of that. The rectus femoris muscle is a large muscle here. The vastus lateralis muscle and the vastus medius muscle. You have the laterals to the side, medius work to the midline of it. Gracilis muscles are in the midline, and the adductor longus muscle. When this muscle contracts here, it pulls the leg towards the body. That's your adductor action. Okay, this goes medially. Okay, you have a femoral triangle and an inguinal ligament. You see the femoral triangle. And in that femoral triangle, that inguinal ligament runs right to the anterior, the superior portion of it. Yeah, the patella, which is your knee, your knee bone. You have the patellar ligament, popliteal fossa, which is the plate with your palpitation of the popliteal artery. And you got tendons of the bicep femoris and the semitendinosus. Yeah, the patella, patellar ligament, and the. Perfect. All right, so here's your patella. You need your kneecap. That's what I was looking for. Okay, the patellar ligament. What connects that down there? Okay. On the posterior side, you have semitendinosus muscle. You have the bicep femoris muscle, long head. Bicep femoris muscle, the short head. You have the popliteal fossa. Fossa is right in here, the whole fossa area. And inside that fossa, you have the site for palpitation, which is feeling or monitoring the popliteal artery that runs behind the kneecap. Okay, anterior view of it. You have the tibial tuberosity, the anterior border of the tibia, the medial malleus, and the lateral malleus. In the muscle area, you have the tibius anterior and the fibularis longus. Okay. In the other areas, right, you have the patellar ligament, the greater saphenous vein, the tibialis anterior tendon, the extensor hallucis longus tendon, the extensor digitorum longus tendons, and the dorsal venous arch. Okay. We haven't got over a lot of them. We'll cover all that. You can see the patella, okay, and the patellar ligament. Okay. You can see the fibularis longus muscle, the anterior border of the tibia. Okay. The tibialis anterior muscle, the lateral malleus of the fibula, the dorsal arch. This is your dorsal venous arch where the blood gets returned, and the tendons of the extension digitorum longus muscle. Then you have your tibial tuberosity. You have your greater saphenous vein. Again, if you can't get an IV started in the arm, if the veins have collapsed or something, a lot of times if the veins aren't available up there, they'll go for the greater saphenous vein. It's a large vein in the foot, and you can start an IV in there. You have the medial malleus of the tibia. Okay, you have the lateral malleus. of the fibula. This is the median mass of the tibia. Tendons of the tibia anterior, and tendons of the extensor hallucis longus. It's an extension here of your big toe. You can see a tendon from that. Let's pop up. Okay. The posterior part of the foot, you have your calcaneus, which is your heel bone, your gastrocnemius, and your soleus muscles. Okay. Here's your gastrocnemius muscle, which is the lateral head on the side, your gastrocnemius muscle on the medial head on the side, and your soleus muscle runs down the middle there. And the calcaneus, we said, was the heel bone. Okay. You have the fibular nerve on the other areas around the leg and the foot, you have the fibular nerve palpitation, the fibularis longus tendon, the calcaneal tendon, and the posterior tibial artery. You can palpate it there. So this is the site of palpitation of the common fibular nerve. Okay. This is the tendon of the fibular longus muscle. This is a calcaneal tendon, okay? And this is site of palpitation of the posterior tibial artery. Okay, and that's the artery that you palpate when you have a diabetic patient and you want to be sure you're getting blood circulation to the feet because of high blood sugar levels. That's the artery you palpate. What's another name for the calcaneal tendon?
Achilles tendon.
Achilles tendon. How did he get his name?
Achilles, the Greek mercenary.
Yep. His father was human and his mother was a god.
And they dipped him in like the gold or whatever.
What's that?
They dipped him in something to make him invincible, and that was how they...
Yeah, that was Thetis. The mom Thetis held him over the river Styx and dipped him in the river. When she held him in the river, she held him by his ankle. So the river got exposed to the entire body except for the ankle. So the Achilles tendon is the only place you can kill him because that's the place he was invincible. He got shot by an arrow and bled to death in the Achilles tendon. That's how it's got its name. Little background information.
Brad Pitt, you mean, got shot in the ankle?
Yeah, he got hit by an arrow in the ankle. He said he bled to death.
Brad Pitt.
Brad Pitt?
He played Achilles in Troy, I believe.
Okay, yeah.
Yeah. That's the only reason why I knew that.
Yeah. All right. Cross-section anatomy. Cross-section anatomy is extremely difficult. It takes a lot of study. It will take a long time to read cross-section anatomy. You'll be able to identify certain structures, but a lot of muscle groups, and then you just have to use it and memorize as you go along. I'm not going to do a lot of testing on this. It's very hard to do to read these things. The cross-section are important for MRIs, CAT scans, things like that. When you view the images, you're viewing from the feet to the head. If your views, the anterior aspect is to the top. The right side of the image is the left side of the body. The left side of the image is the right side of the body. That's how the images are presented. So a cross-section view at the head. Some of the bony structures you'll be able to find are the nasal bone, the ethmoid bone, the parietal bone, the occipital bone, occipital protuberance, and the zygomatic bone. Okay. Easy to find, right? Okay. It's easier on a lateral view because you can see the entire bone, but this is the cross section. This is where it's taken, right at the eye level, and you can see the eyes, you can see the nasal bone, ethmoid bone. It's a little more difficult to make out with its cribriform plate. Zygomatic bone is the arch right here. Okay, this is the occipital bone, all the way in the back here. This is the internal occipital protuberance. That's where it juts inwards. Remember, there's an external occipital protuberance, and there's an internal occipital protuberance, where the bone pushes out, the bone pushes in. And the side at this level where it's taken is the parietal bone right here. Cover all that. Okay, if you go a little bit lower, you get the optic nerve, the optic chiasm, which is just means across, the optic tract, the medial rectus muscle, and the lateral rectus muscle, muscles of the eyes. Okay. So here's the optic chiasm. That's where the nerves cross your optic nerves. So your left eye goes to the right part of your brain. The left eye goes to the right part of your brain. The right eye goes to the left part of your brain. through the optic chiasm. This is the optic nerve. So here's your eye. This optic nerve runs into the optic chiasm. It crosses over, and this becomes your optic tract, and it feeds into the brain. Okay, and it feeds into the lateral genetic nucleus. Okay, and it feeds into the back of the brain here, into the occipital bone. This is where your images are projected in the back of the brain. Okay, so if you ever got hit in the head, there's two things that happen. You can hear bells, or you can see stars. And it depends where you get hit, what's going to happen. Okay? The eyes project the image to the back of the skull, to the occipital bone. If you get hit in the back of the head and cause a concussion, you're literally going to see stars because you're hitting the optic nerve back there, the optic tract of the feet. If you get hit in the side of the head, it's not going to affect your vision. It's going to affect your hearing. That's for your exoacoustic meatus, where your auditory nerve on the side. So if you get hit on the side, you're going to hear bells. If you get hit in the back of the head, you can see stars because of how your nerves run. Okay, so there's your optic nerve, your optic tract, optic chiasm. This is the lateral rectus muscle here, you can see, and the medial rectus muscle here. So the lateral's on the lateral side, medial's medial to it, and those help control the eye movement. Okay, brain structures. We haven't got into the nerves yet, but we will. The substantia nigra, the temporal lobe, occipital lobe. Okay, the cerebral cortex, the hippocampus, the cerebellar cortex, and cerebral cortex. Cerebellum is what's called the little brain, the one behind the skull in the back there. And the cerebral cortex is your main brain, your frontal lobe, and all that. And then your hypothalamus, which regulates your body. Okay, so here's the substantia nigra. This is a nucleus. It's a relay point in the brain. It's where tracks feed in and gets photon and gets sent to different areas of the brain for interpretation. This is your temporal lobe, temporal side of the head. This is occipital lobe in the back. This is your cerebellar cortex. This is in the very back behind, underneath the brain. Okay, hippocampus, cerebral cortex, and the hypothalamus. You can see the ethmoid air cells in the superior sagittal sinus, depending where you cut the section through. These are your ethmoid air cells. See all this white space in here. White space is air cells. Nothing's in there. So when you see white space, you know you got air cells. And the superior sagittal sinus is a groove where the brain invaginates in, and it's this dark area right there. Right around that. That's the superior sagittal sinus that runs across the sagittal suture. Okay, cross-sectional level of C2. Your C2 is your axis. You see the body of the axis, maxilla, and the ramus of the mandibles. So here's the body of C2. Okay. This is your spinal cord, again, easy to see. That's your space where your nerves run down through. This is the maxilla. This is your upper teeth. And this is the ramus of the mandible. Remember, the mandible comes out like this, the body, the angle, and the ramus. The ramus is this part that's going up at an angle here. That's your ramus. That's what you're seeing right there. Okay, muscles at that level. Orbicularis oris. Okay, which is the muscle where? Orbicularis means what?
A circle.
Circle. Perfect. So it's a circular muscle. And oris means?
Eye.
Other one.
Mouth.
No. If the orbicularis oris is a circle muscle around the mouth, is your oculi. It's the circle around the eye. Yeah. Identified before. Capitis muscles, buccinator, masseter, pterygoids, splenius, and the trapezium. You can see all those on this cross section. So here's your orbicularis oris muscle, which is the muscle that goes around the mouth, circular muscle. So it extends down there, then wraps around to form a complete arch in 3 dimensions. Buccinator muscle is on the side of the arch. Masseter muscle is this large muscle right here, which controls most of your force of mastication. Pterygoids are what pull your jaw laterally and medially. These are the pterygoid muscles. The longest capitis muscle is internal there. Splenius muscle and the trapezius muscle. Okay? And this is a sternocleidomastoid muscle as it comes down here as it branches down. Comes from the mastoid, branches down into the clavicle and the sternum with two attachments. Okay. Other structures we're going to find at the level of C2, the median lingual raphe, internal carotid artery, internal jugular vein, vertebral artery, and the spinal cord. Okay. Spinal cord is easy to identify. It's a white space. There's your spinal cord. Okay. The vertebral artery is this little dark dot right there. Okay. And your internal jugular vein is this dark dot right here. And this is your internal carotid artery. Is that dot right there. Okay. And the raphe are the ridges on the roof of your mouth. You can see those cut through that at that section. T2, second thoracic vertebrae. We're going down lower now. You'll be able to find the clavicle, the body of T2, the humerus, and the scapula. Okay. So here's the humerus below the shoulder joint. That's the bone that's cut right there. And this muscle right here, this huge thing, that's your deltoid muscle. That's what pulls the arm laterally away from the body. Okay. This is the clavicle. I'm going to go through a cross section. And this is the body of T2. Okay. Again, you can easily see your spinal cord. Let me get that. You can easily see the spinal cord again, that little white dot. Notice how it's getting smaller as it goes down more and more posterior. Okay. At T2, different muscles, you have to find the subclavius, the suprascapularis, infraspinatus, splenius cervicus, trapezius, and the sternocleidomastoid. And again, here's the sternal head of the sternocleidomastoid. Here's the subclavius muscle. Okay. Your subscapularis muscle. Again, this is your humerus. It's the bone right there you can see. Your infraspinatus muscle. And your splenius cervicus muscle. Okay. And the trapezius muscle runs on the outside, it runs in the back and up and over your neck. Okay. And crossing we're T2, the sternothyroid muscles, pectoralis major and minor muscles, the deltoid, rhomboid muscle, and the multifidus muscles. Okay. Again, your sternocleidomastoid muscle. As it runs down, you see it right there. You have a pectoralis major and pectoralis minor. Okay, here's the pectoralis minor. Here's the pectoralis major, the larger one there on the outside. Again, the pectoralis major is a major muscle of adduction for the arm. The deltoid muscle is that huge muscle right there. You have a rhomboid major. Okay, and your multifidus muscle. Okay. You also can see your spinal cord. You can see your trachea, which is your right hole here. And you can see your esophagus, the hole right there. Okay. So you know when you have white stuff, you have a space. So this is your trachea right here. You see where that comes in. And you always know this is your anterior view of it right here. This is the anterior portion. This is posterior. Okay. So you always know that the trachea is going to be anterior to the esophagus. Because if you cut cricothyroid membrane puncture, you're not going to cut through the esophagus. You're hitting the trachea. That's the first place you're going to see. So the trachea is going to be anterior to your esophagus when you're dealing with these. So we're going to find, now we'll find the trachea, the lungs, the esophagus, shoulder joint, common carotid artery, subclavian artery, and the spinal cord.
What were those two dark areas in the front on either side of the trachea?
Whoops. These two dark areas right here?
Yeah. Because the lungs are behind that.
Yeah, these are the lungs right here. Artery is usually blood. It's probably it's not a muscle, it's an artery. I would say it's part of the aorta as it's being sectioned. That's bilateral. It's could be the common carotid artery, or common carotid vein as a kind of cross section, because it branches out the aorta and then goes a flap to the side, and it could have hit it on the side like that. Okay, so it's either the subclavian vein or the common carotid as it's going across that area like that. Because in the dark there, those are arteries or veins. I'm not sure which one. But when it comes off the aorta, it comes off like that. If the cross section goes like that, it's going to cut it at a wider angle. So it's probably the common carotid or the subclavian vein.
Okay.
Okay, so we got our trachea, which is the white area right there. We got the esophagus, which is always posterior to the trachea. Okay. You got the shoulder joint, because here's your humerus. And here's your clavicle. Okay, the scapula comes in back behind here. The common carotid artery. It looks like it's right there. I think this might be the common carotid artery that extends out here, like we were talking about. So subclavian artery. This is your left lung. This is your right lung. And that's your spinal cord. That's the body of T2. Vertebrae T8. You have the spinous process of T8, the body of the sternum, and ribs 4, 7, and 8. Okay, so here's the sternum. Again, this is our anterior here. Always the anterior. And this is the right side. This is the left side. This is a rib. Trying to see where it's. This is this area right here. This is rib number 4. This is rib 7 and 8. You see the bones right here of your ribs. And the spinous process of T8. Spinous process comes out the back. Transverse processes go medial lateral. Spinous process always posterior. So you have the spinous process of T8. You see the different ribs and then the body of the sternum. And let's see what else we say. It's real easy here. Okay. And you see your heart. We'll get into the different divisions of the heart here too. And then your lungs, and different lobes. Okay. Then go to the heart. We had all these structures of the heart as you get through the heart section. The tricuspid valve, the right ventricle and left ventricle. Okay. So here's your heart. This is the left ventricle. And the left ventricle is going to have a larger muscle mass. And it's one that does all the pumping. It's going to be the thickest muscle is going to be on the left ventricle of the heart. And this is the right ventricle of the heart. Okay. Left ventricle has a much thicker muscle than the right ventricle. This is the interventricular septum. This is what divides the heart. Okay, between the two ventricles. And then the right tricuspid valve is a valve that closes between the atrium and the right ventricle. Okay, we haven't gone through this, but we will. We'll go through all the different valves of the heart and get that in great detail. T8, you have the lungs, the oblique fissure of the lungs, the esophagus, the spinal cord, thoracic aorta, pectoralis major, and latissimus dorsi muscle. Okay. All right, let's start with looking at this. This is your spinal cord in the back here. Okay, this is the right lung, this area right here. This is your left lung. Okay. You can see your esophagus, which is right between the lungs right there. Okay. The pectoralis major is the main muscle for adduction. Left lung has a superior lobe. There's an oblique fissure, which divides the lobes of the lung. And the left lung has an inferior lobe. and latissimus dorsi muscles on the back, and the thoracic aorta is right here. That's where your aorta runs. Aorta comes off the heart, makes an arch, and starts to come back down through the thorax and through the abdomen of the body. Xiphoid process and T10. Again, the xiphoid process is the tip of the sternum, the very end coming down. And this is the body of T10, thoracic vertebrae number 10. And again, you have your sacral segments where the spinal cord starts to get really small right here. Okay, at T10, you also have the multifidus muscles, trapezius muscle, longissimus thoracics, latissimus dorsi, and the diaphragm. Okay, so here's your diaphragm. Remember, the diaphragm is a big mushroom-shaped muscle. There's on both sides. It extends all across here. It's a big mushroom shape. When it pulls down, it expands the thoracic cavity, so air comes in. Latissimus dorsi muscles, latissimus thoracic muscles. Here's your latissimus dorsi muscles and your latissimus thoracic muscles. Multifidus muscles up by the spinal cord, by the vertebral column, and the trapezius muscle on the external part. Okay. You also got the liver, the inferior vena cava, azygous veins, lungs, spinal cord, esophagus, thoracic aorta, stomach, and the spleen. Like I said, we haven't covered all these yet, but we will. This is the right lobe of the liver. This is your liver right here. That's the right lobe of it. You have the inferior vena cava, which brings blood back to the heart, and the azygous vein, which dumps into the inferior vena cava. You have the sacral segment of the spinal cord, the sacral segment. You have your esophagus, which still runs down, that black tube right there. You have the cardiac orifice of the stomach. Here's your stomach muscle. This is your stomach, and this is the opening into the stomach. Okay, here's our spleen. This is for production of red blood cells. And this is your thoracic aorta, as that runs down here. Yeah, the left lung, inferior lobe is right here of the lung as it opens up. Like I said, it's very hard to identify and look at these on a transverse section. And at T12, it shows you where rib number 9 is. There's a rib bone right here. And you're starting to see parts of the large intestine. These white areas right here, all your large intestine. Those two. You have the rectus abdominis at this level also, transverse abdominal, intercostal muscles, latissimus dorsi again, spinal thoracic, psoas muscle, quadratus lumborum, iliocostalis muscle, and longissimus thoracic muscle. Okay. You see where they're all labeled here. In the rectus abdominis, that's one that gives you your 6-packs. Okay. Your transverse abdominis muscle. See underneath it. The intercostal muscles, muscle that run between the ribs. You see one of the ribs right here, rib number 9. Okay. Latissimus dorsi muscles on the outer part of the back. And your spinalis thoracic muscle between the spine and on the thorax there. Psoas muscle major, the quadratus lumborum muscle, the iliocastus lumborum muscle, and the longissimus thoracic muscle. All the different muscles in that area. Again, hard to identify just looking at a cross section. And we'll identify the different parts of the colon here, the large intestine. You have the transverse colon, ascending, descending, and jejunum. Jejunum is actually part of the small intestine, which we'll go over. So here's your ascending colon. You can see the space here. This is your transverse colon as it comes across. And this is your transverse colon on the other side as it loops across. And it starts to go down with the descending colon. You see how it gets more and more material inside of it as you progress. And your jejunum is here. These are all parts of your small intestine as it goes through. And it's cut at different angles. Remember, the jejunum sometimes doesn't wrap around like coils. So sometimes they're going to be solid, sometimes they're going to be open. That's why some of them will be an open space like this. Sometimes it'll be coils like that. Because of the three-dimensional nature of what you're going through. Okay, you also have the liver, abdominal artery, the abdominal aorta, the kidney, intervertebral discs, spinal cord, and renal artery and vein. So here's your renal artery, supplies the kidneys. This is your renal vein, takes blood out of the kidneys. And this is your left kidney. This is the spinal cord. Again, T12 through L1 vertebrae. This is intervertebral disc. Remember, the disc is not a synovial joint. It's a cartilaginous pad that separates the vertebrae. You have the abdominal aorta. Use a circle right here. And the right lobe of your liver. And L5, we still have the spinous process of L5. We have the ilium, the sacrum, and the ala of the sacrum. Okay. So here's the ilium. You can see the different areas where it's attached and different angles it's cut at. But this is the ilium. This is the bone of the part of the pelvic bone. You have the ala of the sacrum. Okay. You have the ilium, parts of it over here, the sacrum, and the spinous process of L5. Remember, spinous processes from all vertebrae always project posteriorly. Okay. The other processes, the lateral process, goes to the sides. Okay. And at that level, you also have the rectus abdominis, longissimus, external oblique, internal oblique muscles, transverse abdominis, iliacus, and the gluteus medius and the gluteus maximus muscle. Okay. So here's your external oblique muscles and your internal oblique muscles. So these are the external, these are the internal. You have the transverse abdominis muscles, which run there. You have the iliacus muscles. Yeah, there's your ilium. You got the gluteus medius on the inside, and gluteus maximus, which is the butts, and longissimus thoracic muscle, and the rectus abdominis. Okay, those ones for your six pack. All right, other structures are the ilium, the cecum, sacroiliac joint, vertebral foramen, and the descending colon. Okay, again, descending colon, part of the large intestine. Okay. Ilium, the small intestine. The ilium over here too. The cecum is a junction between the small intestine and the large intestine, and the sacroiliac joint is between these two muscles right here. Okay. And the vertebral foramen.